The change project I have chosen for my nursing unit is the early identification and prevention of hospital-acquired pressure ulcers. Aside from increasing the quality of patient care and improving patient outcomes, which will always be the highest concern for our unit, the main reason for the implementation of this change project is to save the unit and the hospital money and to reduce unreimbursed costs. Because stage 3 and 4 hospital-acquired pressure ulcers are one of the 8 preventable conditions identified by the Centers for Medicare and Medicaid Services, hospitals no longer receive payment for patients who develop these conditions during hospital stays. The Centers for Medicare and Medicaid Services reported in 2007 that stage 3 and stage 4 pressure ulcers add an additional $43,180 to a patient's hospital stay. The Agency for Healthcare Research and Quality estimates that the cost of individual patient care for a pressure ulcer ranges from $20,900 to $151,700. According to a study published in the journal Ostomy Wound Management in 2016, which used hospital admissions from 2008 to 2012, listed in the National Inpatient Sample Database, containing data from more than 1,000 hospitals, the average overall rate of patients with at least one pressure ulcer across all 5 years was 1.8%. The total number of annual cases over the years of this data remained stable. Geisinger Medical Center reported that in 2017, our hospital had a total of 28,710 inpatient admissions. If we took the average incidence rate of 1.8% found in the study, that would give Geisinger an incidence of 51.678 pressure ulcers developed by patients in their inpatient population within 1 year. Rounding that down to 51 incidences and using the low estimate from the Agency for Healthcare Research and Quality of $20,900, that would mean that my facility spends around $1,065,900 in a year treating patients for pressure ulcers. If we were able to reduce the incidence rate of pressure ulcers by 50%, the hospital could save over $500,000 in 1 year. This would be a major financial benefit for the institution, and this doesn't include the costs that could be incurred from the more than 17,000 lawsuits filed nationally every year dealing with pressure ulcers. And because the Change Project focuses simply on changing policies and procedures relating to nursing care, rather than implementing the use of new equipment or dressings, there are very few financial limitations that would be associated with this project. The financial aspects that would need to be considered include funding time for the leader to develop the project, paying for in-services for the staff to learn the new policies and procedures, and funding the research committee to have the charts audited. Here I have a proposed budget for the costs we would need to fund to implement this project. I would budget out 80 hours of non-clinical time for the leader to fully develop the project, along with 1 hour of non-clinical time per staff member to receive an in-service and education on the proposed changes when they are to be implemented. The unit has 18 registered nurses and 6 nursing assistants that would need to be educated. The last portion of budgeted funds would need to be for the research committee to perform quality improvement auditing on the patient charts. I would have this done for 8 hours a week for 6 months after implementation. The funds for non-clinical time for both the leader and the unit staff would be allocated from the unit's personnel budget, which already allows for a certain number of hours of educational time per staff member per year. The funds for the quality improvement auditing would need to come out of the hospital's operational budget as part of research and quality improvement. Due to requiring some of the hospital's funding rather than only the unit, the cost savings would be split between the unit and the hospital itself, and would be most effective in being utilized to purchase more specialty beds and to trial new pressure-relieving devices or dressings to help further reduce the incidences of pressure ulcers within a facility.